Former Chief Public Health Officer Theresa Tam and BC Provincial Health Officer Bonnie Henry have both been appointed to the Order of Canada in recognition of their roles during the COVID-19 pandemic. Is it because they really enjoyed her statements talking to Mrs. Claus, ordering the kids to get jabbed up for Christmas?
Disrupted.
America that I fought for.
Weird thing to happen. With a story like this, it almost reminiscent of what people like Jerry Seinfeld would say about, award shows, that these are just vague and empty and awards are pretty much meaningless. And when you look at the people that are nominated and partaking in awards, even with, Barack Obama winning a Nobel Peace Prize, even though he had a kill list, even though he was torturing people, even though that he bombed Libya and Yemen so many times that he ran out of bombs, he was attacking Syria, he turned 2 wars into 7, but somehow that's peaceful. Really, really makes you wonder the whole essence of awards or recognition in cases like here in Canada, the Order of Canada, which is the highest level. It's the highest medal of honor you can get from this country. And it's given to great individuals. I'm not saying that it's all bad and doom, but this year's participants, this year's nominees are really a doozy, folks. So, as reported here from Canada Proud, former Chief Public Health Officer Theresa Tam and BC Provincial Health Officer Bonnie Henry have both been appointed to the Order of Canada in recognition of their roles during the COVID-19 pandemic. Wow. The Order of Canada, ladies and gentlemen, used to go to great individuals. Now it's this. It's just gone so incredibly just hilarious when it comes to its nominees. And again, when I see that, reminds me of Jerry Seinfeld when he says about award shows. They're just kind of empty, they're meaningless. But here's a bit of an article here. This is from the Globe and Mail. Even though it doesn't look like the Globe and Mail because I had to put the speed reader access on. But this is from the Globe and Mail. So it says, Doctors Theresa Tam and Bonnie Henry, leaders of the national and provincial level in Canada's efforts to deal with the COVID-19 pandemic, have been both appointed to the Order of Canada. Dr. Tam complimented her tenure as Canada's Chief Public Health Officer this month, and Dr. Henry is still the British Columbia Provincial Health Officer. They have been appointed as officers of the Order, one of the country's highest honors. 83 individuals were appointed to the Order on Monday, including Marc-Andre Blanchard, the former Canadian ambassador to the United Nations, who is set to become Prime Minister Carney's chief of staff next month. Mr. Blanchard, also a former executive vice president for the Caisse de Dépôt, a placement du Quebec investment fund. Sorry, didn't practice my French on that one. Was appointed as a member of the Order. According to the citation, he is being honored for his outstanding contributions to Canada and its economic development. Again, you really grit down on the Order of Canada if the essence is still there and whether these awards are actually, beneficial or not. He has worked tirelessly to ensure that major Canadian organizations take their rightful place on the global stage. In a statement, Mr. Blanchard said that he is humbled and honored by the appointment. I feel incredibly fortunate not only to receive this recognition alongside so many inspiring Canadians, but also to have a career filled with purpose, opportunity, and the privilege of serving my country, he said. The Order consists of a hierarchy of companions, officers, and members. Officers and members can rise based on further achievement. Governor General Mary Simon made the appointments on April 17th, acting on the recommendations of an advisory council for the Order. For Dr. Tam, the order citation notes that her tenure between 2017 and 2025 was characterized by her commitment to health equality and highlighted by her leadership role in the country's response to the COVID-19 pandemic. Is it because they really enjoyed her statements talking to Mrs. Claus, ordering the kids to get jabbed up for Christmas? Because that's what children want. That's what children want. Hey, little Timmy, you're about to get, myocarditis. But they'll tell you it's very safe and effective, and I can tell you that's very safe and effective according to YouTube standards, but you be the judge of your own body. Dr. Henry is noted for using her expertise in public health and preventive medicine to safeguard the health of people in Canada and globally for decades. Notably, as provincial health officer, she led British Columbia's response to the COVID-19 pandemic, the citation says. Dr. Henry is a former medical officer for the Royal Canadian Navy and associate medical health officer in Toronto, who worked in senior health office positions in BC before being named provincial health officer for BC in 2018. Having my name amongst this group of incredible Canadians is truly humbling, Dr. Henry said in a statement. I have been privileged to have the opportunity to live and work in many parts of this great country in the world. To be recognized by my country for my life's work in health and public health is a tremendous honor, and I'm truly grateful. So, notice how the recommendation they're honoring for really vague descriptions. Like, oh, you were in this position during an unfortunate incident of COVID-19. So we have to honor you. But it doesn't go into detail about what they've done during COVID or what their actual work is responsible for. Well, I thought we'd take the opportunity and the liberty to explore that. And being that Theresa Tam and Dr. Henry in particular are very notorious figures when it comes to public health, let's do some digging around on this. So, like this, for instance, this is back, actually, in January of 2025, and it says Chief Public Health Necromancer Theresa Tam unscientifically refers a debunked simulation model that has been used to criticize for glaring biases, claiming that vaccine misinformation caused thousands of deaths and millions in hospital cuts. Tam's comments highlight the overreach of PHAC, that's the Public Health Office, which now faces declining vaccine uptake and growing distrust, particularly among the youth. Here's her line to the general public and gaslighting people about how she scientifically, remember, trust the science? She scientifically came up with this idea to handle misinformation. Instead of giving people the information about the vaccines, about the adverse side effects, or information about hydroxychloroquine or ivermectin, that it's not horse-based, that it's actually proven effective. It's one of the leading medicines around the world. They're treating people with cancer with it. Instead of giving that information, she's tackling the most important thing about this pandemic is the misinformation. So watch this.
Misinformation can have very real impacts, not only for an individual, but for populations. So that's where I work. So I'll speak a couple of things. One is impact of vaccination, of course, vaccination uptake, and any future pandemic response, if you sort of top of mind, kind of just.
So she's trying to deal with the decline in vaccine uptake because people start getting skeptical or realizing or whatever happened to them. People weren't buying her product anymore. And she's also dealing with the fact that she's also dealing with the fact that well, no one's buying her vaccines, but also the fact that
vaccination, of course, vaccination uptake, and any future pandemic response.
And any future pandemics. Any future pandemics. Is she trying to predict something that's yet to come again? Because I'm going to show you that back in 2010, she almost perfectly nailed the so-called simulation. Imagine a scenario where a crisis comes about, where there's an outbreak of a virus that goes around and people don't know about it. How are people going to respond? Are we going to send officers to deal with it? Are they going to be compliant to our agenda? Can they handle this pandemic? Almost like she knew it was going to happen. Almost like she knew that she was going to be granted this position to be the Chief Health Officer of Canada at a time when she knew a crisis was afoot. And those are your two big concerns, that nobody's taking the vaccine and the fact that you want to deal with future pandemics. So here, as Chris Erickson points out, says, did you know that before the COVID event, Dr. Theresa Tam was in a documentary discussing non-compliance, mandatory quarantine, and putting tracking bracelets on Canadians as an option during a pandemic or a plague. This is her before getting involved in becoming the Chief Health Officer of the nation. That she was already predicting to the bone about this scenario that Canadians were going to have to be compliant and dealing with non-compliant people, dealing with quarantine, dealing with how law enforcement was going to have to crack down on people that weren't abiding the medical tyranny agenda. And that's what happened 10 years later. So here's a bit of that clip from this documentary.
I think the public has to know this is one of the worst case scenarios in terms of an infectious disease outbreak, in that their cooperation is sought. If there are people who are non-compliant, there are definitely laws and public health powers that can quarantine people in mandatory settings. It's potential you could track people, put bracelets on their arms, have police and other setups to ensure quarantine is undertaken.
You think she's describing like North Korea or the Soviet Union or even China? Oh, we're going to put monitoring bracelets. We're going to crack down on people that are, expressing their freedom or spreading misinformation or not being compliant to the federal demands. This is 10 years before COVID. Talking about Canada. Not any other government. Canada. And then she miraculously became the Chief Health Officer of the nation. And all of a sudden, guess out of luck, we had the coronavirus. We had a pandemic that caused more damage than what she was trying to prevent. It's just absolutely astonishing that she was able to say this and nobody batted an eye. Nobody even bats an eye now. Nobody even bats an eye now, even after all this has been exposed. She's not going to be held accountable. They're not going to set her down. They're not going to prosecute her. She's able to get away from this. She just recently stepped down. She's able to walk free from all the damages that she has done in defiance against real medical science health. This is authoritarian rule. This is authoritarian measures. So this guy, James R., points out, Dr. Theresa Tam, Canada's Chief Public Health Officer, was in charge of the Winnipeg Bio Laboratory number 4 for 10 weeks, from February 28 to May 6, 2019. What role did Tam play during that time? What did her position at the UN play? Did she give security clearances out? So it was highlighted that before she became the chief health officer of Canada, she was working at this biolaboratory and was sending harmful viruses, mutation viruses, from Winnipeg to the Wuhan laboratory and doing gain-of-function research between the two nations. And again, none of this ever gets national attention. None of this got addressed. They still want you to be angry at people like at the truckers. They still want you to be angry at Tamara Leach. They still want you to be angry at Chris Barber, but not angry about this. Not angry about the fact that we have proof that your so-called national health officer was involved in a huge scandal of an international scandal involving deadly pathogens created through gain-of-function research, which is used as a bioweapon. So here is one of the MPs. So here's one of the MPs in the Senate expressing this concern.
Was not appointed until May 6th of that year. So there was a period of about 10 weeks in which there was no president of PIAC. So my first question is, was there an interim or acting president of PIAC during that period from the end of February to the beginning of May of 2019?
Yes, as is normal, an interim president would be appointed with delegation during that period.
And who was that? What was that role? Was it an ADM or was it a director general? Like what? Who was the acting president during that period?
The acting president during that period was the chief public health officer.
Chief public health officer. And did that person, the chief public health officer, did she have the delegated authority over security clearances for the lab?
The policy on delegation resides with the deputy head. However, the approval of individual clearances is delegated to the chief security officer of the agency.
Okay, and so that wasn't, the delegation to the chief security officer wasn't just for that interregnum period. It's generally delegated at all times.
Yes, given the volume and size of the agency, the sort of day-to-day decision-making on security clearances resides with the chief security officer.
Okay, and when did the chief security officer first become aware of the national security issues at the lab?
So my understanding is that in August of 2018, subsequent to a briefing that was given for general awareness by the Canadian Security Intelligence Service, that the potential concerns regarding the vulnerability of lab employees to potential influence were flagged to the service, and in fact.
So that right there, all the scandals, all the mishandling, all the corruption, just with one person is going to get the Order of Canada, the highest honor of the country. Again, really makes you really think about the what these honors, what these awards really represent. Do they represent the titles that they claim, or are they just picking people that are compliant to a more sinister agenda? Like Barack Obama winning the Peace Prize when you have a kill list. Did he really actually partake in peace? Or was it just, hey, shut up, we're going to make you look good as long as you keep doing our wars? As long as you keep doing the bidding for the military-industrial complex, for Wall Street, for the billionaire class, for George Soros, whoever, we'll hand you this award, we'll make you all fancy and whatnot, but you keep serving us. So that's just Theresa Tam. That's just Theresa Tam. Here, this is Dr. Bonnie Henry. This is the provincial the Minister of Health in BC, she was the one, not only did she had some scorns when it came to COVID, when it came to mishandling of the pandemic, she was also responsible. And here from the Vancouver Sun, BC rejects bid to expand safer supply program to include non-prescribed alternatives to fentanyl. BC's provincial health officer recommended that more people get opioids. She recommended, after we just discovered that they haven't kept track in over 8 years, as we're seeing more and more increases of overdose deaths among children. She's the one that recommended and keeps recommending. BC's provincial health officer recommended the province expand its safer supply program to prevent overdoses. Yet they never kept track. They have no data. And if they did have data, they would throw it out. Because it was never about stopping the addiction. It was never about treating people. It was about human exploitation. That's who this woman is. That's who the other candidate for the Order of Canada is getting. Dr. Bonnie Henry and Dr. Theresa Tam are evil mastermind criminals. And they're about to get the highest order of the country. Here's this woman, Eleanor Sturko, who says in her push to legalize drugs like fentanyl, crack cocaine, and methamphetamine, Dr. Bonnie Henry downplayed and denied the harm caused by her safe supply that has been significantly diverted, especially to youth, fueling addiction, fentanyl use and deaths, and putting money into the hands of organized crime. Dr. Henry does not deserve to receive the Order of Canada. And here's also, this is the most hilarious part, this is the so-called claim to fame during the pandemic that Theresa Tam and Dr. Bonnie Henry really want to address. Not informing people what the virus is or where it came from, or natural natural supplements, ivermectin, hydroxychloroquine, vitamin C, vitamin D, nothing like that. Natural immunity, nothing like that. But they want to inform the public of steps to protect yourself during sex. This is the high point of the pandemic, according to them. That they want to address how people can still have sexual relations during COVID. And some of it is the most absolutely hilarious when you read it out loud. So the first step in this, it says, ask your partner or partners if they're feeling unwell or have symptoms of COVID-19. Wash your body with soap and water. Wash your hands with soap and water for at least 20 seconds. Wash sex toys thoroughly with soap and water before and after use. And then steps that follow it, wear a face mask or cover your mask. Heavy breathing during sex can create more droplets that may transmit COVID-19. Avoid or limit kissing and saliva exchange. Choose sexual positions that limit face-to-face contact. Use barriers like walls that allow for sexual contact but prevent close face-to-face contact. This is the achievement. This is the achievement on top of the mishandling of the pandemic that children being forced out of school have left them behind. On top of the depression and anxiety and mental illnesses that increased during the pandemic. This was considered the great highlight for someone like Theresa Tam and Dr. Bonnie Henry. That they came up with a blueprint on people having sex during the pandemic. And let me tell you, just reading it to you and just how hilarious it sounds, it makes it not at all attractive. Not at all attractive whatsoever. So, the Order of Canada, they're giving to these two participants. And there's more on that list. We heard about, what was his name? Mark Lambert. It really puts in perspective of what these awards, if they're giving it to these individuals and not realizing or even covering up all the scandals, all the mishandlings that these individuals have done, it really puts perspective if the Order of Canada is truly the honored value it claims to be. Like I said, they gave Barack Obama a Peace Prize. Now they're giving Theresa Tam and Dr. Bonnie Henry, one who predicted the pandemic and made it atrocious for this nation, and another who was involved in that, but also allowed for kids to be overdosed on opioids. That's really honoring the best of Canada, doesn't it?